One of the biggest concerns I hear from clients is, what can I do if the hospital wants to discharge me before I'm ready to go home? Well, what if I told you that the day the hospital tries to send you home too early, you can legally say no, and Medicare will back you up? Today, I'm showing you exactly how. Now, if you saw my last video on hospital payment changes, you already know the pressure. Hospitals are now financially rewarded for getting you out the door faster. So I'm not here to scare you again. I'm here to arm you, because there's a specific, powerful right built into Medicare, and the hospital is required by law to tell you about it. The problem? They hand it to you on a piece of paper, buried in text most people sign without reading. Today that changes. Here's the one thing that you need to remember. When you're admitted to the hospital gives you a notice called the Important Message from Medicare. Sometimes they just refer to it as an IM. You'll sign it within 2 days of being admitted. Then, and this is the part that matters, they must give it to you again within 2 days of your planned discharge. That second notice is your trigger. On the back of it is a phone number for something called BFCCQIO. It's a Quality Improvement Organization. And don't worry about the alphabet soup. Just know this, the number is your lifeline. It's an independent third-party doctor's office paid for by Medicare, not by the hospital. Their entire job is to review whether your discharge is actually safe. Now, stay with me because the timing on this is everything. Miss it and you'll lose your protection. So who is the QIO? QIO stands for Quality Improvement Organization. Think of them as the Medicare referees. They're an independent third-party group of doctors and health experts who are hired by CMS, hired by the federal government, to monitor the quality of care that seniors on Medicare receive. The most important point from your perspective is this: they do not work for the hospital, and they do not work for the insurance company. They are neutral. And this is why their review is so powerful. They have the authority to tell a hospital, no, this patient isn't ready to go home yet, and you must keep treating them. And here are the exact steps for what to do. So write these down. Step 1, the moment they tell you that you're being discharged and you don't feel safe about being discharged, call the QIO number on that notice. You must call by midnight of the day that you get that discharge notice. Don't wait. Don't sleep on it. Step 2, tell them that you are appealing against your discharge. The moment you inform the QIO of your appeal, the hospital is required to give you another document, a detailed notice of discharge, that spells out exactly why they think that you're ready to go. That's their case in writing. Step 3, and here's the magic. While the QIO reviews your case, usually within a day or perhaps 2 days, you cannot be forced out, and you are not financially responsible for those extra days. Let me say that again because it's easy to get this wrong. If you file the appeal on time, you do not pay out of pocket while they review it. Medicare keeps covering you, and here's the really good news. This appeals process works whether you have original Medicare or a Medicare Advantage plan. Your right to appeal is the same. And if this is the kind of straight talk, the Medicare guidance that you wish someone shared with you months ago, please subscribe and share this video with friends. I post these so that you're never caught off guard and can make an informed decision regarding your Medicare. And if you've got a Medicare question keeping you up at night, drop it in the comments below. I do read them as regularly as I can, and your question might become the next video. In fact, this entire video is in response to my viewers' questions on the previous videos. So now let me tell you why this discharge protection matters so much. When a discharge is rushed, what often happens next makes your situation worse. It may be a fall, it could be an infection or other complication that results in a readmission within days. And here's the cruel twist. Those potential events can make your situation worse and your recovery more difficult. A recovery that just needed a couple more days may need weeks after a post-discharge accident. So leaving too soon to save trouble can cost you your health and cost Medicare money. But you're not powerless. You have a federally protected right, a free phone number, and an independent doctor on your side. That's not stretching the truth. That is the law. Most people just never knew it, and they never knew it was available to them because it's often buried in text that none of us want to sit there and read while we're in the hospital. So here's what I want you to do. Take a screenshot of these 3 steps, send it to anyone you love who's on Medicare, because the time to know this is before you're sitting in that hospital bed, not during. Or even easier, send a link to this video. One quick note, this appeals handles a discharge that's too early. There's another related trap called observational status that can wreck your nursing home coverage, and I'll cover that in a video coming soon, so make sure you're subscribed. I'm Matthew Clausen with MedigapSeminars.org, helping you make confident Medicare decisions without sales pressure. I'll see you in the next video.